tell us when to start?
Yeah, so I'm just right now, I have to push this little button that makes Zoom go into the Facebook window. So I'm just waiting for that to work. And then once that does, I'll warn you. So it says live right now in your Zoom window. We're not really live. That's just Zoom preparing it for Facebook. So yeah, I'll warn you. And then I have a little intro spiel I'll do, and I'll introduce all of you. And if people ask questions, I'll filter through those and pass those along. And it's usually not an issue, but if there's some oddball question that I ask and you don't know the answer, then you can just say, oh, I'll get that answer, and we can get back to you. You can always comment later and that kind of thing too. So, but it's pretty casual. Hence us starting at 11:03. I'm just trying to see if it went.
We don't have hairs popping up, right?
Yeah, it's crazy.
All right, looks like it went. So I'm going to hit go live and do my little intro spiel, and we'll go from there. Everyone ready?
Ready.
All right. Oh, let me have 1 second. Got a title. All right, now we're going. Hi, everyone. I am Stephanie with 9 Health. It's Minority Mental Health Awareness Month. So that's the topic we're discussing today. It's just kind of an open conversation. So please ask your questions if you have them or share your experiences. I'll introduce the experts we have with us, and then you can also ask questions of them. We have several people joining me this morning. I'm joined by Dr. Larry Curry. He's founder, CEO, and clinical director of the Curry Center. Victoria Trapp, Dr. Victoria Trapp, she's Deputy Director of Programs for the Colorado Department of Human Services, Office of Behavioral Health. Shelley Solopow, Tribal Liaison for the Colorado Department of Human Services, Office of Behavioral Health, and 9 Health expert Dr. Paula Kohli is also joining us. You can ask any general coronavirus questions too, because she's the expert on all things COVID-19 right now, and I think there's some big things happening, so we can discuss that as well. But first, Victoria, I wanted to start with you. Can you just talk about what Minority Mental Health Awareness Month is?
Absolutely, and welcome everybody. Good morning. Minority Mental Health Awareness Month is driven primarily by the U.S. Department of Health and Human Services and the Office of Minority Health. In Colorado, we know that Hispanic, Latino, Black Coloradans, American Indian, Alaska Natives, and Indigenous Coloradans are least likely to receive treatment. Here in Colorado, we want to make sure that we address and utilize this month to help bring awareness and to address gaps in treatment services for these individuals.
And Dr. Trapp, I don't know if you want to continue on this. Someone just commented right out of the gate that we have to be special. We have to have a special month because minorities are, quote, special. So I don't know if you want to address that there is a good reason for having a focus just on minority mental health.
Right. As I said before, I think we all know in Colorado, and this is true of other states, that minorities as a group generally are the individuals that receive less mental health services, behavioral health services across the nation. We recognize that in the state of Colorado. We don't need a month to bring that to awareness. We all know that that is something that exists. We use this month to increase awareness across the state of Colorado and to share our commitment to bridging those gaps.
Yeah, and again, we're talking about Minority Mental Health Awareness Month. Feel free to join the discussion, comment with any questions or experiences, and I can share those. I'm just going to continue going on with the questions I have. Dr. Curry, I'll start with you on this one. What are some of the unique stressors or experiences that Black, Indigenous, and people of color face that manifest in behavioral health?
Well, I think the obvious one is that people of color, I always say my color arrives before I do. And it's the same thing for patients who are seeking services and seeking help. So if they walk into a clinic, if they come into a public service provider, and they don't see people that either look like them or somehow there's some comfort level, I think it tends to create kind of inside of them this internal trauma of past experiences that they've had. So very often the history of oppression, racism, discrimination, whether it was personal, whether it was something that happened in their previous educational life or what have you. And they sometimes may become a little less resistant to being open and sharing, whether it's with their physician, mental health professional, who have you. So I think it's just important to be very sensitive. We say the word being culturally sensitive, And back to the first comment and question in terms of why do we have a month? We should actually have a year-long process, because I know more about the majority culture than I do sometimes about my own. And I often said in raising my grown children with grandchildren, we always had to work at educating our children about who they were and where they came from. We couldn't depend upon the educational system for it. We couldn't depend upon the television for it, because we were always seen on the lower end of knowledge and education about who we were and where we came from. So it is critical for us to take this into consideration, putting yourself in the patient or the client's position when they walk in for services or they seek services.
And I think, we've heard a lot of buzz terms lately too, I think, with the Black Lives Matter movement. We've been, systemic racism has been brought up, racial disparities in the mental health system. Maybe Shelley, you can add to that a little. Again, we're just talking about the unique stressors and experiences of Black, Indigenous, and people of color here in Colorado, specifically with behavioral health.
Sure, absolutely. First, of course, I wanted to agree with what's been said already. My comments really align greatly with that. Speaking more so of American Indians and Alaska Native people, we're talking about very resilient people, as other people of color are as well, and that's really contributed to Indigenous people surviving and to being really self-directed in their own care. There's these shared experiences, though, of historical trauma. And when I say historical trauma, I don't just mean that it happened in the past, but I am speaking about very targeted extinction threats that have occurred in our history, and some of you may be aware of those. So these effects play out in our social institutions, and they're active today. It's not like it's over or that these things don't happen every moment. So they're very sweeping. If I could tell, just a brief example would be like a kid, maybe in school, maybe he has longer hair than other people, maybe he gets teased. He's dealing with this every day, and he's also never hearing anything about the land that the school is built upon. After a while, you start to think, this school isn't for me. This place isn't for me. And yes, that contributes to things like depression or rates of suicide or what I would call grief, and they manifest that way. But I also don't want to paint the picture that everyone who's of color is mentally ill or anything along those lines.
Yeah. I just had a comment to add to that, which is that this year, I don't think Minority Mental Health Month could have come at a better time than it has, because minorities today are under more stress than ever before. And part of that is the coronavirus epidemic, which, as we know, disproportionately affects minorities, African Americans, and Latin Americans. And part of that is the recent unrest that we just discussed, with the focus on systemic racism, the death of George Floyd, the death of several other Black Americans in police custody. So I think more than ever, this month is really necessary this year to really shift a focus to awareness, to underdiagnosis, to undertreatment of minorities, so that we can really work on solving that problem, which I think has really been uncovered by the events of the past few months.
Yeah, that was my next question for you, Dr. Kohli. I don't know if there's anything else to add to that, but with COVID-19, just any additional stressors. I mean, we're all kind of, under extra mental stress, but particularly, people of color are experiencing maybe more mental stress than they would otherwise normally.
Yeah, I would absolutely second that. I mean, not only are they in a position where they're higher risk of complications if they contract COVID, but many minority Americans are in a position where they can't afford to stay home. They have to go to work. They're those frontline workers that we all depend upon. And so they're being put in a position knowing that they're one of the vulnerable populations. And that really adds stress on a day-to-day basis. And we are seeing an increased risk of substance abuse amongst minorities as well, because of these types of stressors that are being placed on them. The other thing I'd add that's adding stress, I think, to the minority community is the fact that the schools have been closed, and they may remain closed. And for a lot of minority communities, the schools are a way to provide childcare, a way to provide healthy meals to their kids. Sometimes they don't have access to internet to be able to do distance learning. So all of these, I think, are tremendous stressors on the minority community that are really unparalleled with the rest of us who do have some of these privileges. And I think we really need to be attentive to figure out how to find solutions for this.
Stephanie, if I can add to the stressors, I think when we look at stressors for minorities as a whole, we recognize that there are several structural barriers or limitations, such as lack of insurance or underinsurance. There's transportation needs. I think Dr. Kohli mentioned childcare. There's a stigma for minorities in terms of accessing mental health. There's also a lack of diverse mental health clinicians in our workforce, particularly in the areas of rural and frontier Colorado. In addition, there's also for Latinos and Hispanics, oftentimes there can be language barriers to accessing mental health services. I think having mental health clinicians in the workforce that have specialized skills, that receive training in cultural competence and really understand the clientele that they're serving, creates its own sort of structural barriers to accessing mental health and substance abuse.
Yeah, and Dr. Trapp, that kind of leads into the next topic I wanted to cover. And Dr. Curry, Shelley, I don't know if you can add to this as well, but just talking about the systemic changes that are needed to make behavioral health care more accessible to Coloradans of color, those people in our state that need that.
Well, and I think also the barriers, we have great policies, not only in Colorado, all over the country, but it's the enforcement, the implementation of it, and the practice of those policies is key. I think we spent a lot of time around the table talking. I actually turned down offers to be on any more policy committees to discuss anything because I want to be with the people. If we do so much policy, I'm also a researcher. If you're too far removed from the clientele, you lose sight of what's really going on. So by working with families, by talking, by supervising other therapists in the office, I'm hearing what's happening every day with clients. So I think we have to realize that the barriers sometimes we create ourselves. I know we have to have policies, but it's the old Maslow's hierarchy. If we don't meet the basic needs of people, a comfort level, being able to engage with them, knowing something about the people that you're working with, being sensitive to their issues. You don't have to solve all their problems, but just showing that human compassion for people goes a long ways. Once that happens in the beginning, you can have the right answer, but if you have the wrong delivery, a patient will never come back again for those services. We know that families and individuals of color tend to be very hesitant about trusting the health as well as the mental health profession because you don't share your personal information with those folks. And those folks meaning the majority culture that don't look like you and don't show that they really are empathetic to what you're going through. So we have to be very careful about not just what we have, but how we use and how we implement those services and making them available to people. We have to go a little bit further to bring people in.
Yeah, and someone just commented a few minutes ago, again, and Mental Health Awareness Month, we talked about was in May. So we've covered a lot of topics in May. Again, July is Minority Mental Health Awareness Month. And someone commented, mental health doesn't care what color you are. Seriously, we need different months for different colors. I don't know if someone wants to reiterate again the importance of just highlighting the needs of people of color, especially people of color in our state, and just focusing on those resources available.
I'm going to just respond very quickly. The DSM-5 applies to people whether of color or not. So someone who is diagnosed with alcoholism, alcohol abuse, bipolar, character disorders, dyslexia, what have you, it doesn't matter what color you are. But if you're not sensitive to and understanding on some level that person in front of you, their culture, who they are, you'll never build the trust. You'll end up with the wrong assessment, the wrong evaluation. And it's simply that person will probably not come back to you for services, and we miss an opportunity to help people. So yeah, it's not a difference in terms of culture, but it's how we implement the tools that we have. And that is throughout our mental health profession with diagnoses, et cetera.
And Shelley, I don't know if you want to add to that and just also talk about the systemic changes you think are needed to make behavioral health care more accessible.
Well, first of all, I do agree with Dr. Curry. I do think in some cases there are cultural differences, but I don't think that's really important for the discussion today. I think the main point that we're trying to make, especially in terms of the question, is that, of course, everyone has mental health disorders regardless. The question isn't that. The question is, what's different about me, my life? How would you approach it? And do we have a sort of cultural humility or a cultural competence level in clinics, not just behavioral health clinics, but medical providers? And what we know is that we don't have that. So systemic issues, Wow, there's a lot. I just want to focus on, I would say, upstream for right now, and how they're related. You know, is my school a place where all the kids are welcome and it feels like their school? Is my grocery store where everyone feels welcome? Is my doctor's office? Those types of things matter. And then so do things like, do I have access to things? Do I have place to live? Do I have enough food and security so my child is not hungry? Those types of things. And it goes on and on and on. It's like that other example I was giving. You don't necessarily notice it until you're in that situation. And so what I would hope is that people are starting to notice more now. You know what I mean? Like with all of this and the topics, that people will look around, whether they're of color or not, and say, wait a minute, like what is happening here? Is this something should I speak up about this? And absolutely do. When we look at these factors, if we go to a doctor and we're happy with our services and we feel that they really understand us, and we have health aides that are trained, and you start to feel like you belong, and it has effects in your lifetime and in your course of your life, and it matters. These little things matter. So oh, sorry, go ahead. I was rambling on.
I was just going to add to what you said, Shelley, and I'm sure Dr. Curry and Dr. Trapp would agree as well, that one of the things as a scientist that I find a systemic problem when it comes to minority mental health is underrepresentation of minorities in clinical research. And so a lot of the conclusions that we make about how to treat people, whether it's their physical health or their mental health, are really based on a largely Caucasian population. And that data is extrapolated to minorities. And we're learning with conditions like hypertension, for example, or diabetes, that there are huge differences when it comes to race. And I think some of that is emerging as well in the mental health field too. So I would like to see more representation of minorities in clinical trials and clinical research so that we can really tailor our approach to these groups.
There are differences in prevention, which I didn't really get to, but I was hoping to get to that when I started talking there, was that really, especially for Native kiddos, if you focus more on building on resilience, it turns out in literature that that actually has a much greater effect. So if we only studied this group or that group, we would never know that. And we would continue to waste our money and not see the same outcomes and wonder why.
Right.
Absolutely.
These are not recent issues. These have been going on for a long time. I've done in-home family preservation training in 38 different states. And one of the things in Michigan, I remember working with the reservation there, is that many children were being diagnosed based upon the standard DSM-4 at that time, and they were not taking into consideration cultural issues. And so therefore, a child that appeared to be withdrawn and quiet was being labeled as something else. And the reality was, it is his culture not to. It would be the same thing in a heavy populated city like New York, where you have a child who is not talking to a mental health professional, who is not of color, and because of fear, you don't let those people know your business. So we have to look at, when we talk about cultural competency and training, it's not just a 1 hour requirement. It's something that agencies have to implement all the way through. If we're going to do systemic change, it needs to be based on outcome, but it also needs to be based on true training that is not just a 1 hour annual checkoff box, but something that an agency has to do day in and day out as a part of what they do. Shelley's office requires us, as being licensed under OBH, to do that. It's a part of our contracts, but it's also a part of how we do clinical supervision. When we review cases, what kind of family is this? Are we talking about Hispanic family? Are we talking about African American, Asian American? What are we talking about? What are the cultural implications here, religion, otherwise, that may be impacting how not only we're serving them, but what's really going on with that family, as opposed to just very quickly labeling them. We treat labels and we fail to treat people.
Yeah, I think that's well said. And Dr. Curry, I don't know if you want to you've talked a little bit about this, but add to everything and just talk about what your organization, the Curry Center, what you do and how you honor the needs of minority clients. And Shelley, same question if you want to follow Dr. Curry.
Well, we have two divisions. We do direct services, mental health assessments and evaluations. We've always Since '79, I've had a contract with Denver County. So Denver Department of Human Services, Adams County, and on an individual basis, outlying communities like Jefferson County and some others, Boulder as well. And so judges can order a family to us. And very often it's because we are a diverse population in clinic and that we are going to do the services and people feel comfortable with that. The other part is that we have an in-home program, which is a prevention of out-of-home placement. So if a child is at risk of being placed in the system, foster care or institutionalized, we put a therapist in the home to do in-home therapy for as much as 12 hours a week, face-to-face. And then I do a lot of mental health assessments and evaluations. We work also with the Department of Corrections, and we're also a licensed substance abuse program. So we're seeing a variety of services to many clients. One of the things that's very frustrating is that very often we will see a family or an individual after they've gone to perhaps 2 or 3 other programs that were not sensitive to them. And so now we're battling the failed attempt, the lack of proper referral, and we're having to have to go back, not just in being culturally sensitive, but trying to undo sometimes very harmful effects. There's a lot of research that's been written about therapists can cause harm. And very often it's not intentional, but it happens. So that's what we do at the Curry Center. We do a lot of individual, family, and couples counseling as well.
And Shelley, same question, just talk about what your organization does to honor the needs of minority clients. And I think you've touched on it a little bit, but just reiterate some of that.
Well, to be completely honest with you, some of the minority client services that we have are out of my scope. So what I can say is that we not only have, obviously community mental health centers, we also recognize that we work with. We also recognize that a lot of folks aren't necessarily comfortable walking into the community mental health center and aren't really sure if they're going to be understood. What I am really proud of is that OBH now is very, very committed, and we work as a liaison. I work with the Ute Mountain Ute Tribe and the Southern Ute Indian Tribe, as well as Denver Indian Health and Family Services, really to hear needs, to understand the ideas. With tribes, of course, we respect their sovereignty, but we also need to understand what are some of the needs so that we can sort of match and help. Like, let's see, can we leverage some of these? Can we get state level funds that fit these needs? And it isn't just about a requirement that the federal government has that we do this. It's also about sounds so canned, but it's true about making Colorado healthy as a whole. Like that's why it's important that there's many Indigenous people in Colorado. And to see, I'm proud. I'm proud that we're working at OBH for that. And then with, of course, the recent climate and Mr. Floyd, we're really looking also internally, like what can we do? Are we doing well? Or are we not doing well? And CDHS is doing that as well. And that makes me feel better about coming on and talking about things when I know that the organization itself is looking at these things.
And Dr. Kohli and everyone, I'll kind of start asking this question as we start to wrap up here, but just talk about, things that minority groups can do to relieve stress and anxiety during this time and just in general to help their mental health.
I think there's many different factors that really, it doesn't just apply to minorities, but just to all of us as people that we can do to relieve stress. So the first I would say is to really have a good support network. And that's really, really important and sometimes challenging as a minority group, but have a friend, a family member, someone in the community that you can call or rely upon to really let off that steam, to discuss things, to bounce ideas off of, because internalizing kind of all of your thoughts and feelings can often precipitate depression or anxiety disorders. The second I would say is be really mindful of the substance abuse, because again, that's a slippery slope, especially at a time like this. You want to be real careful and make sure, that you're watching how much alcohol you're drinking. If you smoke marijuana or anything like that, you want to make sure that you're really keeping those types of substances in check, because those can often exacerbate your feelings. So they make you feel better in the short term, but in the long term, they actually have a paradoxical effect where they make your mental health problems worse. The third I would say is try to, get enough sleep and get good exercise, take physical care of your body, because physical health and mental health are really closely connected and one can adversely affect the other. So make sure you're getting enough rest, make sure that you're getting regular exercise, because exercise has been shown to actually have beneficial effects on mental health. And then the final I would say is know the warning signs. So if you're doing all of those things and it's going in the wrong direction, know when to ask for help and kind of have a lifeline that you can call for help, whether that's your doctor or, whether that's your parent or your child or your sibling or whoever, but just make sure you know when to pull the trigger on asking for more help if things look like they're going in the wrong direction. And really the way to know that something has gotten out of hand is when your mental health problems start to interfere with your functioning or your ability to kind of carry out your day-to-day life.
And Dr. Trapp, I'll let you kind of answer next. If viewers are concerned about their mental health or someone they love, what should they do?
So we'd like to encourage folks to call the crisis line at 1-844-493-8255, or you can text TALK to 38255. Our crisis and peer specialists are trained in trauma-informed response and go through a robust training on the intersections of power, privilege, and mental health.
And Dr. Curry, I don't know if you can add to that as well, just where people should turn if they, need help or know someone that needs help.
We are a Christian-based organization as well, and so faith is very important. And this is one thing that people have been impacted by. They can't go to church. And we know that, even biblically, it says that wherever two or more gather, it's in the presence of God. But, people are having to have to reach outside of the box and really kind of extend themselves, really practicing their faith. So for newcomers, this is different for them. For people who are used to going and part of their routine is to be in church every week, they're now finding different ways. I've been attending church for the past couple of months on Zoom. I know Zoom, Facebook, and all of these things by heart now, but it works. But that's because the foundation was already there. So we have to really reach out to people like Shelley was in, calling people, making sure they're okay, going a little bit beyond to check in with one another, especially the elderly. I think so many people that I know, children are disconnected from their grandparents and aunts and uncles and what have you. Neighbors, a crisis like this, the good is coming out of it. People are learning and meeting their neighbors for the first time. They've lived in places for 2-3 years, never knew their neighbors. Now all of a sudden, people are out the window waving at each other. So we're going back to the basics. And so in something bad, we reach deep and we go back to the very basic sense of human contact and realizing the importance of it when it's taken away from us. I think also just basically thinking in terms of this is the new norm, how you're going to do things going forward. So people who've been resistant to telecom.
Uh-oh.
Did I lose Dr. Curry right when he was talking about teleconferencing? See, that's the world we're in, but yeah, there are some challenges.
Yes, there are challenges. Yes.
If you wanted to finish your thought, I'd let you finish.
Did I lose you there?
We did lose you for a second.
Okay. See,
right
I rest my case. Yes. I'm so connected to this thing now. I'm walking around with a mask or with one of these all day long. But this is the new norm. This is what we're adjusted to. And so we have to, whether you want to think outside of the box now, you have to look at things in a different way in terms of communicating with people. So help people. That's my last piece. Reach out and help people, because people really, especially the elderly, they need help and they need assistance with this. I think teachers right now should get a pay raise, because every parent I've talked to, they are tired of teaching math and reading and whatever. They think that it's time for them to go back to school.
Yeah, realizing the hard work that the teachers do every day for our children, for sure. So I did post the links in the comments to the Curry Center, where Dr. Curry's from, the Colorado Crisis Services. I posted the link to the website and the number to call or text if you need help. 9 Health Fair also has free screenings for anxiety and depression on our website. They're just a questionnaire. They're anonymous, and it's a good, quick way to get kind of a baseline of where you're at, even for the day. If you're just having a rough day, you can take that questionnaire and see if you need to reach out for some extra help. Also, a reminder, if you have a health question, it's mental health, any health question, you can call our 9 Health Neighbors line at 303-698-4455, extension 2005. Leave a message and a 9 Health medical volunteer will call you back within 24 hours. You can talk to a real person on the phone. Doesn't have to be a teleconference like we were just talking about with Dr. Curry. And if you know someone that doesn't have access to internet or doesn't have access to these Facebook Lives like we're doing, give them that number and they can reach out and ask the questions they need to ask. Thank you all so much for joining us. If there are additional questions, you can post those in the comments, and I'm going to let everyone go and sign off from here. Thanks so much.
Thank you.
Thank you.
Thanks.
Bye.
Thank you.
All right, we are done. Good job, everyone. Thank you. I hope everyone got what they wanted to say, and I think we had